Okay, so we've done the first check. Now I've gotten Miss Mary to do our second check. So I'm gonna go back to the beginning. The same way we did it the first check, I'm gonna grab my patient identifier. Okay, Miss Mary, I have our CMAR. I have here Myrna Smith. Myrna Smith, MRN is 4302, 4302, and she's in room 14. She's in room 14. This one I can put it away because I don't need it anymore. So for you guys, I would recommend doing the blocking here. Here we have notes. We have no notes. That means we give our pills whole. Next, we have her allergy is penicillin, and right below it is the date. So today's date is October 16th, 2025. We're gonna do the same always. MRN, name, room number, 3 here. Here, notes, allergies, date, 3 here, and then we wanna do the page number, okay? With Miss Mary. 1 of 7, Myrna Smith, 2 of 7, Myrna Smith, 3 of 7, Myrna Smith, the same way we did it. 4 of 7, Myrna Smith, 5 of 7, Myrna Smith, 6 of 7, Myrna Smith, 7 of 7, Myrna Smith. Tell her it's been signed by the nurse. Back to the beginning. Block our information so that you're focused here. So here we have not due, not due, not due, not due. Aha, we have due at 9 o'clock. On hand, we have atorvastatin, 20 milligram tablets. The doctor's order is 21 milligrams. So we're going to tell her it's a 1-to-1 ratio. We're giving 1 tablet. Once you've explained that to her, you get the tablet. We want to show her that we've checked it. Atorvastatin. Do your checks. 1, 20 milligrams. Our second. Here's the tablet. And the date, expiration date is 2026. Good. That's our second check. Second big check mark. Second check. Put it to the side, away from everything else. Put it completely different so that you know what's checked, what's not checked. Then we're gonna tell her. So we've done our second check, then you're gonna tell her about it. Miss Mary. Miss Mary, I have atorvastatin here. It's a lipid lowering agent, an HMG-CoA reductase inhibitor. My patient is taking it because they have dyslipidemia. Look, I will show you. Let's flip it back. In the past medical history, you will see, look, dyslipidemia.
Yeah.
So they're taking a lipid lowering agent to reduce the lipids. Here, the action is that it blocks the enzyme HMG-CoA reductase, which is needed by the body to make cholesterol. So if we block that, we lower the cholesterol. And that's what we want because they have high cholesterol.
Yes.
Some adverse effects we're going to look for is rash, abdominal cramps, constipation, diarrhea, flatus, heartburn. More serious is rhabdomyolysis and hypersensitivity reactions. As nursing management, we want to monitor for muscle weakness, monitor creatinine kinase levels, and we want to avoid grapefruit juice when we give it during therapy. Also, we want to monitor dietary intake or fat intake, do some patient teaching, or if they're not able to understand it, we can teach the family. So those are some nursing interventions for it. And all things considered, I believe that it's safe to give.
Okay.
That's what we want to say, that if it's safe or not. So it's safe to give. So once I've done my second check with her, if she has any questions, she will ask them. Do you have any questions?
Yeah, usually, and I know that you have taken your blood vital signs, and prior to giving the medication. Do you think, based on your vital signs, that you're still safe to give the medication?
Yeah, so if this was a medication where the vital signs were like super prominent, like any antihypertensives, dilaudid, anything that would alter the vital signs in any way, we would give her our vital signs that we've taken prior. So I will give you my vital signs, and based on everything, it is safe to give.
Okay, great.
We'll put our second dot after the time. So this is first check, this is second check.
Nice.
We will do one or two more. So here we have, next is due. On hand, we have Bizacadil tablets, 5 milligrams. The doctor's order is 10 milligrams. Miss Mary, I've done my math.
Yes.
And so I've done it here. Bizacadil. See, 10 milligrams is the doctor's order. Over 5 milligrams is what we have on hand. It comes out to 2 tablets. And I'll show you, this is what also they have here. So we're going to give 2 tablets. I did not have this drug card, So I made one. But before that, we're gonna check it, right? So we have Bisacodyl, 5 milligrams and 5 milligrams. 5 milligrams and 5 milligrams equals 10 milligrams, and that's what the doctor has ordered. So we're doing our checks, right? Circle it. Here's the tablet. Here's the tablet. It expires December 2025. And we do our second big check to say that we've checked it a second time. Put it over here with the second check medication. Then we will tell her about it. So the medication is Bisacodyl. Brand name is Ducalax. It's a stimulant laxative. This patient is taking it because they have chronic constipation, as seen in the past medical history. The action is it stimulates smooth muscles, increases peristalsis by direct effect on the intestinal mucosa and on nerve impulses. So it causes it increases the movement of our stomach so that we can pass stool. The onset is 6 to 12 hours, peak is unknown, duration is 12 to 24 hours. Side effects include abdominal cramps, nausea, diarrhea, and hypokalemia. Please don't ever put nausea and vomiting for Miss Mary. Ever. Some nursing implications would be assess bowel sounds for abdominal distension, electrolyte imbalance, and frequency and consistency of stool. So based on this information, based on what I've gathered, I believe that it's safe to give. So I will put my second dot. So for the sake of time, we're just gonna skip. I will just show you guys how to prepare a stock bed that's not already in a package. So we'll go to the Senosides. So here we have due at 9 o'clock. On hand, we have Senosides tablet, 8.6 milligrams. The doctor's order is 17.2 milligrams. Miss Mary, I've done the math. 17.2 milligrams over 8.6 milligrams equals, let's cross these out, equals 2 tablets of Senosides. And that's exactly what we get here. We take our bottle, same way we compare it, Senosides. The dose is 8.6 milligram on hand, so we have 8.6 milligrams. And the expiration date on the bottle, as we've done before, is October 2026. So it's okay. To prepare a stock med like this, we want to get a cup. We open the bottle and we pour directly into the cap. That's because if we pour too many, we can pour it back, right? If we pour it into the cup, if we pour too many, we cannot pour it back. So here, if we go, we'll get 2. We have 2, and I will pretend to put it in the cup so that we don't waste it. Put it in the cup, and then you have your 2. Senosides. So then we have our Senosides here. We put it on the side, and then I will tell Miss Mary about it. Miss Mary, I think that the Senosides are safe to give.
It's good.
Second dot. Oh, okay. We've gone through everything that we have to give. We tell her the PRN medications. We tell her the generic name, the trade name, and the classification, right? So dimenhydrinate is Gravol. It's an antiemetic. Glycerin is an osmotic laxative. Hydromorphone is Dilaudid. It's an opioid analgesic. Lactulose is a stimulant, is an osmotic laxative. And Miss Mary, last but not least, mineral oil. It's a lubricant laxative. Aha, we're at the end. We've done our second med check now. The hard part is over. Once you're done with that, you do it for both of your patients. If you have 2 patients, one after the other. And you put it back in your box, right? We don't want to leave things out because you might not be giving it right away, right? So we want to put everything back, but make sure that it's separate from everything. So usually there's a divider, or if not, leave everything else in the bag except for what you're going to give. Put it in the front, everything we want to give. Senosides go back. And that's it. And then when you're ready to do it, you do the third check as if you did the first check, only afterwards you're tearing it and putting it into your cup. And that's what it is. Those are your checks. Good luck, guys. Good luck with your med check.
Thank you, ladies. You did a great job.
She did a great job.
So did you.
You
Yeah,
did a great
you
job.
guys did awesome. Thank you.